Hello everyone, welcome to Knowledge About Medicines. Today, we are going to learn about magnesium sulfate injection, an essential medicine widely used in emergency medicine, obstetrics, and critical care. What is magnesium sulfate injection? Magnesium sulfate is a mineral supplement and emergency medication that helps regulate nerve function, muscle contraction, and heart rhythm. It is considered a life-saving drug in several medical emergencies. Uses: magnesium sulfate injection is commonly used to treat eclampsia and severe preeclampsia to prevent and control seizures during pregnancy, treat Torsades de Pointes, a life-threatening abnormal heart rhythm, correct severe hypomagnesemia or low magnesium levels, manage severe acute asthma attacks when standard treatments are not effective. It may also be used in certain cases of digitalis-induced arrhythmias. How does it work? Magnesium sulfate works by stabilizing nerve cells and reducing excessive nerve and muscle activity. It also relaxes smooth muscles, dilates the airways, and helps maintain a normal heart rhythm. In pregnant women with eclampsia, it prevents seizures by reducing abnormal electrical activity in the brain. Administration: magnesium sulfate is administered intravenously, or intramuscularly, IM, by trained healthcare professionals. The dose depends on the patient's condition. For example, in eclampsia, a common loading dose is 4 to 6 grams for over 15 to 20 minutes, followed by a maintenance infusion as prescribed. Continuous monitoring is essential during treatment. Side effects: common side effects include flushing or warmth, nausea and vomiting, dizziness, sweating, muscle weakness, low blood pressure. In high doses, it may cause loss of deep tendon reflexes, respiratory depression, slow heart rate, or cardiac arrest. Precautions: patients receiving magnesium sulfate should be closely monitored. Healthcare providers should regularly assess respiratory rate, blood pressure, urine output, and deep tendon reflexes. Use with caution in patients with kidney disease, as magnesium is eliminated through the kidneys. The antidote for magnesium sulfate toxicity is calcium gluconate, which should be readily available during treatment. Conclusion: magnesium sulfate injection is a life-saving medicine used in emergencies such as eclampsia, severe asthma, Torsades de Pointes, and severe magnesium deficiency. It should always be administered under strict medical supervision with continuous patient monitoring. Thank you for watching. If you found this video helpful, please like, share, and subscribe to Knowledge About Medicines for more evidence-based medical education videos. Stay informed, stay prepared, and help save lives.